Welcome to another Ask Me session where I answer your questions about strategy, operations, data, and evaluation for nonprofits, foundations, public agencies, and other organizations providing education, human, and social services. I'm Tamara, your sidekick, here to help you to make a bigger impact with less sacrifice. The first question that we have today is, besides going virtual, what can nonprofits be doing while there's still a pandemic? First, especially if you have stopped your services, I really think that this is a great time for organizations to be re-strategizing, to take a step back and ask yourself, what are you really good at? What is your mission, and how in this world today and moving forward, does everything look different? Like, try not to stay stuck in what you've been doing in terms of the operations or the processes or the exact services, and really think, what is it that I can do as an organization that's going to be in our wheelhouse, that's going to fit within our mission in the way that the world is now? And sometimes that might mean narrowing down. So maybe it's, cutting out a few services that were the ones that you were already kind of stretched for, or you had already kind of gotten just because you were chasing money. It might be focusing really heavily on the services that you're best at, that are creating the most impact right now and have the most demand in the current status of the world. And it might be doing all the things you've been doing, but just with more intention. Also, I recommend partnering. I'm a big fan of partnering. There are lots and lots and lots of organizations that are serving the same missions. Sometimes they're duplicative. Sometimes they're supplemental. But in terms of partnership, one of the best things you can do is think, who can I partner with that is either doing the same work as us, that maybe we can increase each other's capacity by coming together, or who does complementary services that I could actually bring in to have a little bit more of like a wraparound care type approach. Really, I think what I'm seeing is that now during the pandemic, case management and care coordination, this idea that people have multiple needs and that we could connect them with things that address those needs. I think that's everyone's job now to a certain degree. It's not just people who take on case management with case managers. We have a responsibility to help people to fill their financial needs. For example, if we're a health organization, and we don't necessarily have to provide those services because that's not our expertise, but we can be that warm handoff to connect them with other organizations that do that. So creating a network of partnerships that can help you really genuinely help the people you serve more holistically. I also think it's a good time to strengthen your infrastructure. And I don't mean necessarily by investing more, but by revisiting what systems do we have in place. Anything that you do more than once is worth systematizing. And so thinking, like, is there a cheaper way to do this in a more effective way? Right? So don't do things just because they're less expensive, but do them because they will actually make it so your staff are dedicating less time to getting the same process done with the same level of quality or even a higher level of quality. There are ways to do this with all of our technological infrastructures. I think it's time to embrace that, some people could work at home all the time. Not everybody necessarily, but can you open your mind to what systems actually would be beneficial for our staff and the participants that we're serving? The next question is, our nonprofit invests annually in program evaluation. This year, the report basically said that our program has no impact. I'm left with this mediocre data and report that we've promised to report on to donors. How can I handle this, and how might funders react? So first, I want to emphasize that having no impact is different than having no value or having done nothing. Impact, when it comes to evaluation, is like the long-term thing that you're trying to change. And really, think realistically. Did you expect in the time frame that you were evaluating to really have been able to create change in this long-term impact? If it's a long-term impact that requires a high dosage of services over a long period of time, and this evaluation was over maybe only a year, could you have even created impact in or change in that impact that you measured? And fit this into the bigger picture, because evaluations are not really useful fully on their own. They have to be fit into the bigger picture of your organization. So you're progressing toward this long-term impact, and maybe you haven't achieved change in that long-term impact yet. But what is the story behind it? So who do you serve? How many people did you serve? How did you serve them? What was their experience going through the program? What successes and challenges were internal to your organization and also external in the context your organization was in that either helped or hindered you from being able to create your intended outcomes? If you kind of share the journey that you've been on and focus less on that impact hasn't changed yet, but focus on this is what we're moving toward and that hasn't changed yet. But in that journey this year, these are all the lessons we've learned. This is what's worked. This is what hasn't worked. And what are we going to be doing differently now that we've learned these lessons? And some of that could even be lessons around your evaluation of saying, we learned that only measuring long-term impact is not very helpful. And so my last recommendation is moving forward. So, I mean, you can't do anything necessarily now, but with the current report, but with your future evaluations, think more of the map of the journey for your participant. So don't just look at the very end goal. There's lots of things that have to happen before that end goal changes. And so mapping out the journey from the short-term outcomes, the things that happen right away, to the intermediate outcomes that happen maybe in a few months after they've been in your program for a while. And think about every step of saying, okay, if they just joined, if they have been in for this many weeks, if they've been in for this many months, what would we expect our outcomes to be at those points, and measure those different time points with measures that fit those outcomes. That way you'll be able to show more of a journey in your evaluation reports in the future, because you'll see where the changes are happening and what you might need to be focusing on in the future. And supplement with anecdotes. Your current report maybe only has like one big number, but there are stories of the people that you interact with every day. So talk to those people who it's made a difference, and just get their like a little case study. Interview them or have them just like give you a little bit of a explanation as to the benefits that they've experienced in your program to supplement that one big number, so it doesn't seem like you didn't do anything at all. So that's it for today. I am here every Monday answering your questions, so please go to the form that is in the link of the description for this video and submit your questions so that I can answer them next time. See you all next week.